Welcome back to Healthcare Sucks. This is the less blabby version of Healthcare Sucks today. We're going to jump right into it. Here's Italy, guys. With less blabbing. Promise.
More people have died from the new coronavirus in the last 24 hours, bringing the death toll to nearly 200. Meanwhile, 28 new deaths from the outbreak were reported in China, taking the total to 3,070. The number of cases from the virus has topped 100,000 worldwide. More in this report.
Coronavirus scare continues to spread as new confirmed cases of the disease reported in regions outside China are increasing. In France, 200 new COVID-19 cases were confirmed, while India and South Korea also reported an increase in the number of infections. 21 people have tested positive for coronavirus on board the cruise ship stranded off the coast of the U.S. state of California. The World Health Organization says the virus has the capacity to spread and may last till summer.
We do not know yet what the activity or the behavior of this virus will be in different climatic conditions. We have to assume that the virus will continue to have the capacity to spread, and it's a false hope to say, yes, it will just disappear in the summertime like influenza virus. We hope it does. That would be a godsend, but we can't make that assumption.
Global stocks have tumbled and oil prices have collapsed as investors panic over the expected damage of the coronavirus to global economic growth. Wall Street stocks also suffered another bruising session, with petroleum producers and banks especially hard hit.
What we've clearly seen here is a number of weeks of selling. There's definitely panic within the financial community to a certain extent because stocks are trading at a discount of 20, 30, 40%. And we have to realize that 12 trading days ago, or 14, we were at a record high. So big trees fall hard, you know what I mean?
Millions of students are still out of schools and universities worldwide, as many countries have shut down academic institutions amid coronavirus fear.
Good evening and thanks for joining us. We are watching the spread of the new coronavirus again tonight and the potential impact on you. There are now 54 confirmed and presumptive cases in Canada, including another new case in Alberta and 2 new ones in Ontario. We're also watching that cruise ship stranded off California with 235 Canadians on board. Test kits were airdropped to that ship by helicopter because a man on a previous voyage died of COVID-19. And late this afternoon, the American Vice President announced 21 people on board have tested positive. 19 are crew members, but only 46 people of the 3,500 people on board have been tested at this stage. And right now, none of them are going anywhere. Back here in Canada, there is now at least 1 case of community spread in BC, a woman infected with COVID-19 who has no link to travel from a country where there's been an outbreak. BC's public health officer says the woman's every move in the last 2 weeks is now being traced.
We want to know everybody she's been in contact with since she developed symptoms. We go by day, you know, where were you here? How did you get there? We do all of the details. Did you go by bus? Did you take a private car? Those are all things that are being investigated in detail.
She says that rapid, detailed response and lots of testing means the virus is being contained in Canada. Of the 54 confirmed and presumptive cases here now, most are in BC and Ontario, where there are 2 new cases. One is a man in his 20s who was in Italy. The second is a woman in her 60s who got back from Iran. Both are now in self-isolation. Quebec now has a 3rd case, a presumptive one. It's a man who was recently in France, where he believes he caught the virus from someone he knows. And there are 2 presumptive cases in Alberta. One was just announced, a man in his 40s in the Edmonton area. He just got back from the United States. The other case is a Calgary woman in her 50s. She's a former passenger from the Grand Princess cruise ship. She was also a worker at ATB Financial, and now 2 of its branches in Calgary are closed. Testing here in Canada has ramped up much faster than in the U.S. BC and Ontario have their own tests now, and capacity at labs is being increased. The federal government has committed $27 million now to fund coronavirus research.
And real quick, I'm just kind of letting you rent to this. I said less blabbing if you watched the last video. This is the WHO BSers telling us that something don't behave like the flu. Well, I'm not sure about all that. We'll see.
There is now a total of 98,023 reported cases of COVID-19 globally and 3,380 deaths. We are now on the verge of reaching 100,000 confirmed cases. As cases increase, we are continuing to recommend that all countries make containment their highest priority.
Can go to one more question.
We have to assume that the virus will continue to have the capacity to spread, and it's a false hope to say yes, it will just disappear in the summertime like influenza virus. We hope it does. That would be a godsend, but we can't make that assumption, and there is no evidence right now to suggest that that will happen. So we need to fight the virus now, not live in hope that the virus may disappear on its own.
Well, and there you go, guys. Here's people quarantining themselves. This might be interesting to see. Better safe than sorry.
Dumplings with the family. Nothing unusual here, except for the reason why they're all here. They all think it's possible they're infected with the coronavirus.
Even now, nobody can tell how long it takes people to get an infection, So we need to be very cautious.
To escape the outbreak, Carmen Guo put her parents and daughter on a flight from Beijing to Toronto. They were healthy, but once they arrived, out of an abundance of caution, they decided to go into a kind of self-imposed exile, total isolation, to avoid even the smallest chance of infecting others. That was more than 2 weeks ago. And to be clear, nobody asked them to do this. They just did.
This is a responsibility. We are try our best to keep the community safe.
Carmen also asked her son, Kingsley, to stay with friends. He was not to come into contact with the rest of the family arriving from Beijing. He agreed.
I saw that, with big cities like Beijing shutting down, there was no one in the subways, and there was no one at the Tiananmen Square. And that's when I realized, wow, people in China are really taking this head on,
Taking it seriously.
Yeah.
And so that's why you wanted to.
Yeah. If they're doing that, then I should be doing something here on my end.
But that meant you couldn't live at home, you couldn't see your sister, your mom, your grandparents?
No.
Because they would all be in isolation.
Yeah.
Today, their self-quarantine is over. No one got sick, and they've since celebrated their good health with some much-needed fresh air. But as
14 days. Keep that in mind. How many days do they got still to go? 14 more. See, that's the thing with this 14-day thing. If you're going to do it, you do it 30 days. Oh, real quick. California, I was contacted by somebody down there, said there's almost 1,000 people have already went into quarantine in California, dude. And this is self-quarantine like this. In other words, they bugged out to a location or locked down. So some people are taking it serious. I'm not going to blab. I said I wouldn't. How about if we see the president signing some money? 59 minutes ago.
I asked for 2.5, and I got 8.3, and I'll take it.
But real quick, I'm going to touch on this for a second. Sure wasn't the wall where you asked for 2.5 and you get 8.3 billion. Sure wasn't the wall. That's all I'm going to say, guys. With that, I seriously wonder where the money's going to go. I always wonder where the money's going to go and how it's going to be spent. We all should. Because you know where that money came? Out of our pockets.
8.3 billion. Doing very well. But it's an unforeseen problem, not a problem. Came out of
Virus in India, taking the total number of cases to 32. The new confirmed case is from the Jammu Medical College. Let me go across to my colleague Ayushman, who's joining me live, getting us those updates there. So Ayushman, one more person there tested positive in India. This coming in from Jammu Medical College. Can you take us through the details of this case?
Well, Purva, the two of the suspected cases were there from Jammu, and as per the sources, we are being told that one confirmed case has been found in Jammu. So far, the official release hasn't come, and the details are awaited. But we are being told that the patient is currently stable. He has been isolated. But there were two earlier. There were two cases of suspected coronavirus infected people, and currently, the sources state that one person.
5 minutes ago.
Hotel Radisson Blue in Guwahati, where the coronavirus affected tourist had stayed for a night at room number 224 on March 1st. And special preventive measures are in place to deal with any eventuality. The second floor of the hotel where the US tourist had stayed has been vacated. And not only this, 23 staffers of the hotel have been kept under special observation. The staffers who came in contact with the US tourist who has been detected positive for COVID-19 virus were identified on the basis of CCTV footage.
वो असम के नहीं हैं, वो यूएस के हैं और उनको भूटान में डिटेक्ट किया गया है और हमें कल इन्फॉर्मेशन दी गई थी हेल्थ डिपार्टमेंट से गवर्नमेंट ऑफ असम से लोग आए थे तो उन्होंने पूरा एरिया चेक किया है हमने चेक किया है वो रूम जिसमें वो ठहरे थे उसको हमने सील कर दिया है इनफैक्ट हमने पूरा फ्लोर सील करके रखा है और हम पूरे सैनिटाइजेशन पे ध्यान दे रहे हैं
They're taking measures, they're sanitizing.
वो सेकंड फ्लोर पे रुके थे जो पूरा फ्लोर अभी कॉर्डन ऑफ है
And it's coordinated off, second floor.
वो और उनकी ट्रैवल पार्टनर थी और उनकी ट्रैवल पार्टनर को अभी डिटेक्ट नहीं हुआ है जो उनके साथ ठहरी हुई थी ये हमारे पास मीडिया से न्यूज़ आई वो लेस देन 1 डे और लेस देन 20 आवर्स आई वुड से वो एक्चुअली আমাৰ ইয়াতে তেনেকুৱা কোনো প্ৰবলেম নাই প্ৰবলেম এটোলৈকে হোৱা নাই যিজন মানুহ আছে
कोरोना वायरस को लेकर जम्मू कश्मीर सरकार ने जम्मू के 2 जिलों सांबा और जम्मू के सभी प्राइमरी स्कूल्स को बंद करने का आदेश जारी किया है वही जिला उपायुक्त सांबा रोहित खजूरिया ने बताया कि सरकार ने फैसला लिया है और जिले भर में जितने भी सरकारी एवं गैर सरकारी प्राइमरी स्कूल हैं उनको बंद करने का आदेश जारी कर दिया है हमने जिले के सभी अस्पताल के डॉक्टरों को हिदायत जारी की है कि वे सभी मरीजों पर
COVID-19 is rapidly spreading worldwide. Here's a look at how fast things are developing. This is late January. As you can see, the vast majority of cases were in China. A month later, cases outside China began to grow, and it only took another week for the virus to spread to every continent except Antarctica. 72 countries outside China have reported over 10,000 cases. On March the 4th, 14 times as many cases were reported outside China than inside. A few challenges so far in the fight against COVID-19. The first is a cover-up mentality, which proved to be the worst enemy of an epidemic. In Hubei, the epicenter, local officials should have disclosed and reported more information sooner to avoid a larger outbreak. In South Korea, the founder of a religious sect did not disclose his travel history to Wuhan and resulted in half of the country's
continent and specifically in South Africa. Our continued coverage of this topic. Health Minister Zweli Mkhize is under pressure following the announcement that a KwaZulu-Natal man tested positive for COVID-19. The virus will most likely put added stress on the country's already stressed healthcare system. On Friday, Parliament's Portfolio Committee on Health inspected the screening process at OR Tambo International Airport, and that committee is expected to brief the media on its observations. Joining me this afternoon to discuss this is political analyst from Political Futures Consultancy, Daniel Silk. Thank you very much for your time this afternoon, Mr. Silk. Now, the timing of the coronavirus's arrival in South Africa is notable because the Health Department is already under pressure as it tries to convince skeptics that the National Health Insurance is viable here. How do you see these two issues intersecting?
But the issues do intersect, and I must just say the timing is also obviously unfortunate because of the technical recession that we are now in. So there are economic implications more broadly that will affect us. But national healthcare insurance, of course, has been a hot topic in South Africa in recent months. Government is trying to present a credible case that the state indeed can take on more responsibility when it comes to treating the majority of South Africa's citizens. And the arrival of the coronavirus clearly is going to test the readiness of state healthcare facilities, so the practical readiness, and also it's going to test the bureaucratic readiness as well. The Minister of Health thus far, and it's only been a few days, of course, since we've entered the global club of nations with a confirmed case, the Minister of Health thus far has put on a good show. He's looked credible, he's looked in control, and he's looked as though he's on top of the available information as well. Now, it'll be critically important for government to continue along this vein and to make sure that the potential spread is contained, and if it's not contained, to make sure that it's managed in an efficient way. Otherwise, it's going to be difficult to sell this enhanced role for the state in healthcare. So it really is an awkward time, but it offers the ministry and from the ANC point of view a chance to actually show that they can be quite efficient on this issue. And I dare say they want to take advantage of that chance that they have.
Now, looking at that readiness and the state of healthcare, specifically across poorer communities, the understanding is accepted that poorer communities will be hardest hit should the coronavirus spread amongst South Africans instead of just being imported cases. When we look at our healthcare system, it's already constrained, especially for those poorer communities. The Health Department has said it is ready. Do you believe that that readiness will continue to be the case should the virus spread further?
Well, I think at the very least, we've got a global focus on this issue. So, yes, I think the existing infrastructure has been weak. I think capacity at hospitals, particularly in more rural or poorer parts of the country, have been stretched or in many cases deficient, I might add. We've seen examples of that. But where you've got a global focus, where you've got the World Health Organization offering distinct protocols and assistance, and the World Health Organization only yesterday did commend South Africa for being one of the countries that will...
Overnight, the mayor today calling the spread unpredictable and worrisome. Many new cases tied to one man who took that train into the city, and tonight, another major move. The city asking residents who have recently traveled to any sort of hotspots around the world to self-quarantine. ABC's Whit Johnson from New York City tonight.
Tonight, the number of coronavirus cases doubling in New York to at least 22.
Just imagine in places like that, guys. 12 monkeys.
Most linked to a lawyer who frequently commuted out of Grand Central Terminal, one of the busiest train stations in the country.
The community spread dynamic is unpredictable and worrisome. So we're watching carefully.
His case causing a remarkable ripple effect. Health officials saying he spread the virus to his wife, their 2 children, another family, and a neighbor, who all went on to infect others. At least 18 people in all, traced back to one.
Did you see that graph in the 18 people from one? And what if those 18 people do 18 people, and those 18 people do 18 people? Now you're getting the drift. Don't forget what was ordained or talked about through Council of Time, Brother Mike there, Pastor Paul in the interview, that if things continued the way they were, and this is 2 weeks ago, that we're looking at, 60% of the world could have this. That's a serious number to think about, guys.
Man, The city now reporting more than 2,700 people ordered to self-quarantine. Gillian Steinberg is one of them.
Ideally, we'll be back in school next week.
She teaches English at SAR Academy in the Bronx, where one of the lawyer's children attends school. It's now shut down. What is your biggest concern?
In case you didn't catch it, 1, 18, 2,700 self-quarantined or quarantined. Are all those people going to get their bills covered? Are they going to get their rent paid? The credit rating to stay the same? Postponement of all debt collection on their bills? Banks waiving any late fees or anything? That is what I'm saying, guys. 1, 18, 27. It's you. It's you, or you maybe. Or your neighbors. Or your friends. And have we got an answer of how they're going to survive it? And if you survive it, how are you going to survive the economical downfall? Are you going to lose everything that you work hard for? Are you going to lose everything that you tried to have this credit rating that we fight so hard to have and to keep so we can buy all these wonderful things out there? These are the questions we need to call our government, state officials, senators, all the way up to Mr. T. We need an answer. And it needs to be the right one. In addition to that, you get quarantined. They give you a little card with food, balance, and cash on it. So you can have food delivered to the house. Period. That is what they need to do. And that's what they're going to do one way or another if we put our foots down and make them take the responsibility for us, the U.S. people in this America together, that are going to reach out and say, hey, it's time to help us. It's time to take a responsibility. And with that, we're going to let you go. Stay safe. Make sure you're prepared. And healthcare sucks. Over and out.